Welcome to the Susan Brender Show. It's all about you. Featuring shows on health and wellness, the performing arts, politics, and people who inspire you to be your very best. And now, here's Susan Brender.
I'm Susan Brender, and this is the Susan Brender Show. Today, I'm so glad to have my next guest on. He's a friend of our show, and he's given us so much information and education all about the body. Today, Scott is going to talk a little bit about hands, and I'll explain a little bit more why we made this decision to discuss this subject. Now, Scott Miller founded Miller Physical Therapy in Delray Beach, Florida in 2006. Miller Physical Therapy helps patients ranging in age from 8 to 108 who are in pain from injuries related to falls, sport, accidents, as well as patients who have undergone surgical procedures. Now, I want to welcome to our show again Scott Miller, and I want to tell you something, Scott. I have got so many responses from your shows. They're not aware of the things that can happen to them and the results that have an influence on their later life. And I'm talking about when they start to say playing sports when they're about 5, and then suddenly when they reach 50, everything starts to fall apart. Now, let's start with the first question.
Well, first, I want to thank you once again for having me on your show. I really enjoy speaking with you and being on the show to help educate your audience as well as you. All right. Well, physical therapy helps patients who suffer from injuries related to to accidents, to falls, sports-related injuries. We work with patients post surgery. We help reduce pain, improve and restore mobility, and we work on helping improve a patient's function and helping them return to their prior level of activity.
Do you see patients of all different ages?
Absolutely. We've at my office we treat patients anywhere from 8 years old and up, and I did say up to 108 because we have seen our oldest patient who was 104 years old. So we do see patients pretty much of all ages. And physical therapy in general, not just my office, but there are specialties out there that do treat pediatrics from birth up all the way up until the elderly.
Now, Scott, the patients that you see who are 8 years old, why do they need a physical therapist? Because, 8-year-olds, their bodies are very flexible and they participate in many different things. But, coming to a physical therapist, why?
Well, the patients that we've seen in our office usually are orthopedic in nature, which means that generally, if a child, an adolescent, suffers a sprained ankle playing soccer or playing sports, or falls and fractures an arm, they will usually need a little physical therapy to rehab their arm or their leg so that they can return to their level of activity that they were before.
Mm-hmm. Now, let's talk about older people. What do they generally suffer from?
Well, we see a wide range of injuries and conditions here. We do specialize in orthopedic injuries, whether it's sports injuries that an older individual has overused their shoulder or their knee, and they're just complaining of aches and pains in their bones or their muscles and joints. We also range to patients that we treat for balance and strength and just overall stability and safety to work with the patients.
Is it inevitable that older people are going to have different problems? Because it appears to me, I'm not sure that this is true, but it appears to me that when you see a lot of people in a physical therapist's office, it's because age just catches up to them.
Well, we're as you age, you naturally lose muscle mass, and you certainly become weaker. You start losing a little bit of your balance and proprioception, which means just your body's awareness of where it is in space. And as you do get older, your joints start to break down, and you start to develop degenerative joint disease, which means that the joint itself is not as fluid as it once was. So you have a greater susceptibility for injury to that joint and pain and stiffness, and which ultimately makes you a greater risk for injuring yourself.
We've talked about sports like this new pickleball, which is the craze in Florida and probably all around the country. But it's an interesting thing. When I go over to the tennis stadium, and I play, and the audience, well, they probably don't even know what pickleball is, but nevertheless, what I see sometimes is somebody who's really old, like 90 years old, playing tennis, and wow, can they smack that ball? Is there something about their bodies that makes it able to do? Because 90 years old, 80, to play tennis at that age?
Well, most likely those people have been playing tennis or whatever activity that they are continue to be playing. They've been playing most of their life. They've stayed in relatively good shape. They've been physically fit. They're relatively healthy. They've stayed strong. They've stayed flexible, which enables your body to withstand the test of time and enable yourself to continue playing and continue enjoying the things that you like to do.
Now, when you started physical therapy and you started working with all kinds of people, is there a difference between what you were able to do before and now? Is there progress? Different kinds of therapies that you've found out work better on the body?
Well, there's constantly reemerging research out there that brings up newer techniques, that newer modalities and different types of treatment that may not have been around 10 years ago or 20 years ago that continue to be researched, and that is why we are required to be doing continuing education and continuing learning new techniques and new things throughout our career.
Mm-hmm. Is there any use for stem cell therapy?
Well, that's kind of outside the scope of physical therapy, but we do have patients that have undergone stem cell treatments for joints and to help with pain and to help prevent the joint replacement. And I have seen some good results. I've seen other patients that their joints may have not been a candidate for the stem cells, and it may not have worked, and they did require the joint replacement surgery or another surgery. But there has been a lot of advancement and research done out there for the efficacy of stem cell treatment for specific tendons and joints.
Now, I know I didn't ask you this before, but is there let's talk about food for a minute, your nutrition. Does that help in any way if you eat a good meal? I mean, what kind of food would help the bones, the joints, the tendons? Anything you recommend?
Well, ideally, you need a well-balanced diet, which means a good proportion of fats, of carbs, of carbohydrates, and proteins. And you really need to eat to have a sufficient enough calories that you're able to sustain natural muscle growth. So, not eating, yes, you may lose a little bit of weight, but you are going to lose a lot of muscle mass, and you're not going to be will not have the proper nutrition to help sustain a healthy lifestyle. So, just having a well-proportioned diet and portion control is very important, and just eating generally healthy is very important to be physically fit.
Yeah. What about hydration?
Hydration is very, very important, especially down here in Florida, where we do have the heat most of the year, and with the humidity, you certainly do sweat a lot of your bodily fluids out. So it is very important to continue replenishing them with the proper amount of water. Without the proper hydration, your muscles, your bones, your joints can certainly become very dehydrated, which can in turn cause muscle breakdown, tissue tearing, overall fatigue, and muscle cramping, which all can result in injuries to the joints or muscles.
Now, we're going to turn to a subject about the hand, and the reason that I asked Scott to discuss this subject is because I'm suffering from something called carpal tunnel syndrome. So I want you, Scott, to give them a definition again of the carpal tunnel syndrome and how it affects your hand and how it affects your whole body, in fact.
Well, carpal tunnel syndrome is basically when someone experiences numbness and tingling and weakness in your hand because of a pressure in one of the nerves that comes through your wrist. And there's a specific nerve and several tendons that run from the forearm to your hand through a very small little space in your wrist called the carpal tunnel. And this nerve controls movement and feeling in your thumb and your first three fingers. And when there's a compression of this nerve and the tendons through this what I said, the carpal tunnel, it's going to start causing the compression of that nerve. It's going to cause the numbness and the tingling and the weakness in through the thumb and the first three fingers of your hand.
How common is this problem?
It can be very common, and it could be common in different specific activities, or it can just happen for just an unknown cause. So a lot of times we see this in posture-related issues, depending on as far as workstation issues for people at a desk that are doing a lot of typing, and their wrist is in a certain posture and in a position that is conducive to developing this carpal tunnel. And it's very important to assess someone's workstation and assess how they're doing a lot of their work, and try to readjust the way that they do the work so that it can take some of that compression and some of that tension off of that nerve.
So, Scott, what is done for a patient in physical therapy following surgery to the wrist and the hand? And we'll talk about some other parts of the body, but I'm interested because, needless to say, this is something that has affected me. So tell our audience a little bit what you do to make them feel better.
Well, in some cases, in some patients, after surgery, you can certainly lose a little bit of your range of motion in your wrist, just as a direct result from the surgery, or even from some of the symptoms that you were experiencing before, caused some of the tightness and weakness in the hand. So we really need to work on strengthening of the muscles of the hand and the little muscles in the fingers and the wrist and the forearm. We have to make sure that we restore your normal range of motion in that wrist. After surgery, you can certainly lose a little bit of the range of motion for your wrist. And then, of course, with some patients, scar tissue may develop around the incision and around that wrist, and physical therapy can certainly help decrease some of that scar tissue. We do some soft tissue massage to that area. That's going to help loosen up the muscles and the tendons and help break up some of the scar tissue in the wrist.
Now, can surgery be prevented? You know, when you go to various surgeons or orthopedic surgeons, I should say, it's inevitable that they're going to suggest that you have an operation or procedure of some sort. Now, is there a way to avoid that?
Well, you know what? There's a lot of reasons and causes for, as we discussed before, for the carpal tunnel. And my first suggestion to patients is, to try to fix some of the causes of, got to address why this patient is getting this carpal tunnel, why this inflammation is happening, why this compression of that of the nerve and in this carpal tunnel. So we have to address why it's happening. We need to see if we can fix the causes of it, and in some cases, if it is not too late and the compression is not too severe, we can certainly see some improvements if we fix the initial cause. And then, of course, we try to treat some of the symptoms as well. So if some of the tightness in the wrist is causing some of the symptoms, we try to do some therapy to strengthen up the hand, to improve some of that compression, improve that range of motion. And in some cases, depending on the severity of the case, we can certainly see some good improvements. However,
I know you're biased, but I'm very interested in knowing what sets the Miller physical therapy, what sets it apart from other physical therapists? Is there something that you do in your practice that is extremely special? And, if that's the case, tell our audience a little bit about that.
Well, our, my office, we pride ourselves on the individualized care that we give each and every patient, and the amount of hands-on manual treatment that we provide to each and every patient of ours. I've worked in several different practices, and I've been a patient myself in physical therapy, so I've seen a lot of different types of practices. And I have seen, places that you go to that do not do a lot of hands-on, a lot of manual therapy, which I think is especially with this specific injury we're talking about, is crucial for a patient's recovery. And in most cases, that is the skilled part of us being a physical therapist, is the actual hands-on treatment that we provide for patients.
Now, when a patient leaves your office, do they have to do anything that can help them recover sooner? Because sometimes you leave the office as a patient and you say, okay, I just had treatment. Now I can forget it. I'll go back for more treatment. But I have a suspicion you think that there are things and exercises that they can do. Am I right?
Absolutely. As physical therapists, we are, we are educators to our patients, and we are trying to develop a good exercise / treatment program for our patient, and it doesn't just end in their treatment. If a patient is with us two or 3 days a week, working with us for about an hour each session, it's only about 2 or 3 hours a week, and it's really, really important that these exercises and stretches are part of a lifestyle change, and exercise program is implemented into their daily life in order to prevent these issues from coming back in the future, and to continue working on their strength. Because if they're in treatment for the hour and we really see some improvements while they're getting treated, and we got a much better range of motion and they're feeling great after treatment, most likely if they don't do something for another 3-4 days, they're going to come back, and it's going to be kind of right back where we left off. Maybe some little residual improvements, but for the most part, they need to continue with stretches and exercises while they're, as part of a home exercise program.
Now, put yourself in a school. Say you were invited to, we'll start with a high school. You were invited to a high school to give a talk about physical therapy, because a lot of the high schools have all kinds of sports teams. So again, put yourself right in the place where you have an opportunity to tell people how to take care of their bodies, and I'm talking about young people. So what would you tell them?
Well, you got to make sure at that young age in high school to try to be as active as possible, to do at least 30 to 45 minutes of some sort of physical activity each and every day, at least five or 6 days a week. And one activity might be good for one child or one high school student or even one individual, which might not be good for another. So it's just important to keep the body moving, keeping it strong, whether it's anything from a walking program to a weightlifting program to playing a high level sport. Just real important to get the body moving. And with in this day and age, with how technology has taken over our lives, we really have to put the phone and the tablets down at least an hour a day and get outside and do a little bit of physical activity, and it's going to really help keep them physically fit and active, and and hopefully lead them to a healthy lifestyle as they get older.
Are the schools and the administrations of the schools doing their job? Are they interested in making sure that kids are healthy? Because it seems like they cut out a lot of money from all these different programs. Is this one of them?
Well, I know, when I was a child, and I'm sure when you were a child in school, we had recreation and gym class every single day of school, and I know that they are adding more and more academic programs and more diversity in other programs to the schools, and cuts have to be made and time has to be made for these other programs. So, it is. Not just the school's responsibility, but it is, the child's responsibility and the parent's responsibility to really, have, to get out there and be more physically active.
Mm-hmm. Okay, so last but not least, I always like my guests to give the last word. So, Scott, what would you tell the audience, again, after you've had this chance to see so many different people in different conditions? What would you tell everybody? I would love to know.
Well, the biggest thing that I would recommend to patients, or to pretty much to anybody, not just patients of ours here, is that if you are having pain, if you are having a joint issues, you should always have it checked out. Be proactive about your body, about your health. Because if you do wait too long and you wait until it becomes a debilitating injury, it can be too late. And if it is recommended that you do have surgery for a specific injury or body part, do your due diligence, have second opinions, and really try the conservative approach 9 out of 10 of the times, because most of the time a conservative approach to treatment can usually help avoid going under the knife, because surgery is not always the answer for patients. There is a time and place, and surgery is amazing thing to help with these injuries, and it's just real important that you know your body, and that that you do your research before you just let it go.
Yeah. Well, that makes a lot of sense. Well, my guest today has been Scott Miller, founder of Miller Physical Therapy in Delray Beach, Florida. I want to thank you again, Scott, because I think that people need this information, and you're going to kind of have to repeat it and repeat it and repeat it, because it has to sink in. So I think that you did a great job, Scott, and thank you very much for being on my show.
Well, thank you, Sue, very much for having me on your show, and I look forward to being on here and helping provide any information that I can.
Okay.
Thank you very much.
Well, if you're in Florida, but if people want to know how to reach you, how do they do that?
You can always start by checking out my website, which is www.miller-pt.com, and that's it's for Miller Physical Therapy. I'm always available. You can reach me through email through my website. Then we have hundreds and hundreds of pages on injuries and research articles, and lots of really good information on the website that can steer you in the right direction if you have any questions. And please feel free to contact us through the Contact Us page on the website, and I'd be happy to respond as quickly as possible if you have any questions regarding your body, an injury, or any questions.
Well, thank you again, Scott. So, today my guest again has been Scott Miller. I want you to reach out to him. He's got a great practice. He really understands the body, and he's going to help a lot of people. So thank you again.
Thank you for listening to the Susan Brender Show. To be a guest, email sebrender@yahoo.com.